right, let's go. Let's get this started. Hi, everybody. I'm Mayor Stefan Roots. Good evening. Welcome to the Mayor's Lecture Series. I began this series to bring experts like you to present on topics relevant to Chester residents. These lectures equip us with information, connect us to resources, and stimulate community thought and discussion. Topics have ranged from housing in Chester, gun violence and mental health, the Underground Railroad in Chester, and more. Please let me know if you have any topics or speakers that you'd like to request. Tonight we're joined by Brian Corson, founder and CEO of MVP Recovery LLC. That's a lot of letters. Let's do that again. CEO of MVP Recovery LLC. If I was a rapper, I'd do something with that. What is MVP Recovery? You may have seen it as you drive around town. They were founded in 2014. The MVP Recovery Behavioral Health Program supports individuals in achieving the 4 components of long-term sustainable recovery. MVP Recovery, like I said, is located right here in Chester, but I brought them here because I'm not sure if they're serving a lot of Chester residents. And that's what he's going to talk about today. What is this connection between MVP, which is located in Chester in more than one location, and the residents? Is there a connection? Is there a deliberate disconnection? Or how hard are you working to connect to the Chester residents? And we're going to hear about that. I'm going to, in all honesty, just say that they've reached out to me on a couple occasions and say, how can we reach more Chester residents? So it's not that they don't want to reach Chester residents, and you'll know better than us who your I shouldn't say residents, but who your patients, clients are. We really want to know. This is a really Chester-centric discussion tonight. A lot of people in the community also have concerns overall about, what is these different type of houses that do these type of behavioral services. So there's sober living houses, there's treatments, there's all kind of definitions. So hopefully you can help us define what is what and what differentiates MVP from the rest. I will say that I know MVP has gotten a lot of money from the opioid settlement money that's being dispersed throughout the county. So the county really does depend on MVP to provide services throughout the county. They're located here in Chester, and they seem to be good stewards of the money that they've received. Let me tell you a little bit about Brian himself. Brian is a dedicated licensed clinical social worker and is certified as an advanced alcohol and drug counselor, as well as a trauma counseling and relapse, as well as in trauma counseling and relapse prevention. He has a profound commitment to improving the lives of individuals affected by substance use disorders and brings over a decade of experience in the substance use treatment field. I'm going to get out of the way. The next voice you hear will be from, let's do these letters again, the CEO of MVP Recovery LLC. Take it away, buddy.
Thank you, Mayor. Good evening, community. My name is Brian Corson. Thank you, everybody, for coming here tonight. Thank you, Mayor, for asking me to speak. It's a privilege to come here as a 4th-generation Chester resident, to be able to come here to City Hall and to be able to share about what we're doing in the community and what we hope to do here in the community. First and foremost, I want to say, since Mayor Roots' administration has taken office, the support that we've gotten to expand our services here in the city. He's been, down to the center, within weeks of taking office and asking us, how we can serve people in the city of Chester more with behavioral health. How can we get out to educate people more, to let people know the programs that are available? As someone born and raised in the city, we oftentimes I would see, agencies come to the city and they come to the city, but they're not serving the city. And a goal of ours here from day one is to serve the city in which we operate. And I can't thank this administration enough for allowing us and giving us the tools to do that. And I want to thank Sergeant Ross here from the Chester Police Department. The Chester Police Department has been so supportive in identifying the fact that arresting our way out of drug use, out of mental health, isn't an option. We had the opportunity to team up with the Chester Police Department last year where we had certified recovery specialists ride around with Chester police officers 3 times a week, where the Chester police officers would take our certified recovery specialists, which are peers in recovery, individuals that have 2+ years in recovery, taking them to areas throughout the city where it was known that people may be actively using, some drug areas, some places where people were actively drinking out in public, and our CRSs would talk to them about their experience, how they struggled with addiction at one time, what they did to get sober, and what they're doing in recovery today. And to see the Chester police interact with the community, to see real community policing like that, hear a lot of things on TV, read a lot of things, and we hear the word community policing, but we went around with these Chester officers for an entire month, 3 times a week, and to see that they knew the spots, the people by name, and we were able to engage with a lot of these residents was a really cool experience. I look forward to continuing that collaboration with you, Sergeant Ross. I want to talk about the programs. I have Melody McCready here, who's our warm handoff program coordinator. And if you can hand out those packets, I want to talk about the programs we have here at MVP. As Mayor Roots talked about, our initiative to get the word out, we had a great meeting with Corey Long with the To Make a Change group about 3 weeks ago about how we can provide services to the people that he serves within his nonprofit. And we were talking about some of the programs that we have. Many of these programs, as Mayor Roots spoke about, that are funded through the state and through the county and remove so many barriers, such as somebody not having insurance or somebody being underinsured or somebody not having transportation. There's so many resources here that have removed those barriers, and that's what some of the things that I wanted to talk about with these programs. We had the privilege of opening our program at 2200 Providence Avenue just about 2 years ago. And one of the reasons we opened that is there was a grant opportunity came out, and we looked up some statistics of what overdoses look like here in Delaware County. And I want to share some of that, with this group tonight. Delaware County experienced an upward trends of death due to drug overdoses from about 118 in 2012 to 257 in 2017. From 2018 to 2019, the estimated number ranged from about 196 to 202 overdoses a year here in Delaware County. Delaware County had the highest overdose rate of any county in the 5-county Philadelphia region other than the city of Philadelphia. In 2021, it was estimated that about 11,781 people in Delaware County were diagnosed with a substance use disorder. In 2021, Delaware County had 186 overdose deaths. What we also saw in 2021 was an increase in drug overdose death for African Americans. In Delaware County, the rate of hospital emergency room visits due to drug overdoses in the second quarter of 2022 had nearly doubled for African Americans than whites. So we're seeing that. As I do a presentation, I did it when I was a grad student at Widener, and called The Opioid Epidemic. I always started off with the fact that there had been an opioid epidemic in my community since, as long as I could remember. I remember my dad talking about it, friends of his that died of drug overdoses in the 60s and 70s. But we didn't hear about it. There weren't programs, there weren't funding. It wasn't until the mid-90s, the early 2000s, when this thing that we called the opioid epidemic crossed the bridges of cities like Chester or Philadelphia and found their way on the main line. And people were overdosing and using drugs and losing lives in socioeconomic areas that never experienced that before. And as we look at these statistics, as these things are increasing for our community here in Chester, we have a major health system that at that same time was closing all behavioral health services in the city. That hospital system operated the only outpatient opioid treatment center on this side of the southeastern Delaware County. There's 2 in Lansdowne on the other side near Upper Darby, none on this side of Delaware County. So we brought this grant to Delaware County to open our OTR, Opioid Treatment and Recovery Center on Providence Avenue, to fill that gap of that behavioral health services closing. And our goal there was to serve individuals in the city of Chester and on this side of Delaware County. That center officially had opened at the end of December, so I always say January 1st of 2024. So that center has been open a full year at 2200 Providence Avenue. We're able, I'm big into outcomes, showing, what is your success? We can talk about it anecdotally, but what is the data that you have? And we had the opportunity to serve 101 individuals that had opioid use disorder during that year. 49% of our clients that came through were City of Chester residents. We looked at our health components. So when we talk about the MVP program, it's built on the 4 components of long-term sustainable recovery as defined by SAMHSA, which is health, home, purpose, and community. So we looked at, of this, in this year, we have our clients do assessments, answer questions, so we can get this data and these outcomes. We saw that our clients that were participating, they had a 71% decrease in ER visits. So when we talk about the fact, with emergency rooms being closed throughout the county, with our ER here in Chester being inundated, individuals utilizing that when they have a substance use issue or a mental health issue when they probably should not be coming to the ER, and there's already a backlog of hours and hours of people waiting, to be able to reduce that number, the benefits of that, countywide, that ripple effect that we look at. Our clients reported a 67% improvement in overall health, a 71% improvement in obtaining secure, stable housing, a 54% reduction in legal issues, a 72% increase in length of sobriety, a 60% improved family relationships, 45% entered or re-entered the workforce, 62% strengthened positive community connections. So, when we talk about that health, home, purpose, and community, being part of something, being part of a community, that's a big aspect of the MVP program. A lot of our clients, we do requirements of community service that we do here in the city. We do quarterly community service at St. Catherine Drexel. It was BKD when I graduated, but my school in Providence Avenue, where we help out there with setting up for different holidays, helping the convent take out the air conditioners, just giving back, being a part of. We see the self-esteem of our clients, giving back to the community and being a valuable member of society, how beneficial that is. Some of our additional programs, and they're in these brochures here, and these are countywide programs, and they're available, and we really want to get the word out here in Chester, is the Delaware County Warm Handoff Program, which Melody oversees. This is a 24/7 program. And when we took this over 3 years ago, the basis of this program was those certified recovery specialists that I had talked about earlier. They would meet clients or patients when they would overdose and be brought to Crozier Hospital. And the goal was helping them get into treatment from there. Not just being released after a 24-hour observation, after being hit with Narcan, and then most of the time when I'm left without getting any treatment, kind of leaving and going back to what I was doing, right? So we took that program over when that health system suspended behavioral health services. And at the time, we were having barriers with getting in the hospital to engage with individuals. Since this hospital used to have this. So we didn't just kind of want to sit around, so we opened this warm handoff program to the community. We thought if we're not able to get in the hospitals, let's just post this number everywhere. It's a 24/7 number. It's free of charge. Anyone can call that's a Delaware County resident if they need drug and alcohol help, and now mental health as well. And we opened that up to the community, and the warm handoff previously saw about an average of 40 individuals a month that they would help place. And, we have that up to 120 to 150 people a month. Last year, we engaged with almost 1,800 people here in Delaware County, and we placed over 1,500 people into treatment with an 86% success rate. And that success rate just goes hand in hand with that CRS component that I spoke about, that peer helping a peer. It's one thing for a doctor to be talking to someone, a police officer, a social worker, but there's nothing more powerful than when somebody with 2 years of recovery walks in and says, hey, 3 years ago I overdosed. 3 years ago I was arrested. This is where I am today. This is what I did to get there. So that peer support, being able to meet a person where they're at, really has increased the success of that program. And out of those, almost 1,800 engagements, 917 were from the community. The other 800 were from the hospital. So with opening that up to the community, it really enhanced the availability for people to reach out for help, where it's not just, there's a lot of people that do not go to the hospital that need help. So for people to reach out. Another program that we work through with that is, we work a lot with Chester Police Department, is the Law Enforcement Treatment Initiative. And that doesn't have its own brochure, sorry. So, but it's very similar to the warm handoff, except instead of the hospitals calling us, we're getting called by the police. So the police engages with an individual who has a low-level crime. Maybe they just shoplifted, maybe they just got pulled over, they have possession, and the police officer, their discretion identifies, I don't see a purpose of locking this person up tonight for them to be back out tomorrow doing this again. I'm gonna get them into treatment. They call us, we get that person into treatment, their charges get frozen, and they have to follow through with 90 days of continued treatment. We do weekly reports to the district attorney's office. If that person completes that, it's like the crime never happened. And this program was in effect for 18 months by 2 different providers before we had taken it over 3 years ago, and it had a total of 2 people in it. And again, it was, as Mayor Roots was talking about, again, the barrier sometimes to outreach to people to let them know this program exists. And we saw the word was not getting out to the police stations. The communication was not there. Every police officer we talked to about this program said, wow, what an amazing program, but it just wasn't connecting. We were able to really, some leaders within 14 different police departments in Delaware County utilize LEDI this year. And I'm very proud to say that Chester was number 2 on the list, and working to see them bringing us individuals that, get the help that they need and have that external motivator at that moment. Sometimes I may not be ready for help. You ask me, hey, you want to get help? I might not want it, but sometimes when I have that external motivator of, hey, like, you're not going to get these charges, that can help me make that decision. But again, in talking to the police officers, it's not a get out of jail free card either, because individuals have to participate and be compliant during that designated period of time, staying sober, participating in aftercare. So it was really a full wraparound, where it wasn't just somebody getting out of something, but having that accountability after the fact, a huge part of recovery. And engaging with the police, one of the barriers that we had seen was LEDI, just like the warm handoff, is 24/7. Individuals can call, police can call at any time, and it normally happens, late at night, on a Saturday night, right? And we looked at, the benefits of having a physical location, and that's where a new grant had come through to the state to have a mental health substance use stabilization center. And what this is, it's a 24/7 behavioral health urgent care. And with everything that was going on in Crozier, thought of no better spot than there at 2200 Providence Avenue to have what we call the Star Center, where this is where individuals, regardless of what insurance they have, regardless of what's going on, these are the people that usually fall through the cracks because they're not quote unquote bad enough to get a 302 and be involuntarily committed. They don't have anywhere else to go, but they still need that help. If they, and this is a proactive program, because if someone's seeking that help, when I'm just having the intrusive thoughts of maybe hurting myself, but I don't have that plan yet, if I get that help, maybe I don't go to that level to get that plan where I need a 302 or I hurt myself or somebody else. So the Star Center in conjunction with working with the Chester Police, is now a drop-off where when they engage with individuals that have a mental health or a substance use, they can drop them off 24/7, and then we link them to treatment. We get about 98% of the people that are getting dropped off to us placed into an inpatient treatment center. There's hundreds across Pennsylvania, and we work with them directly where they'll come pick them up, get them, or we'll send them in a medical lift to that treatment center. And we have the funding where if someone doesn't have insurance, they can get that county funding. If individuals don't have transportation, we have the funding for the transportation. So many of these barriers that have existed for years, and sometimes they were excuses as well for people, we're taking them away. So we're taking the barriers away for people that really want treatment, and we're taking the excuses away for people that say, oh, I can't really get it right now because I can't get there, or I don't have insurance. And that's what these programs have done. And I can't speak highly enough of Delaware County Council and the District Attorney's Office and the county government that has supported these programs and these grants that have come through. And when we have identified underserved communities, like we took over a large number of these programs prior to the suspension of the behavioral health programs by Crozier. If they would have just waited, the warm handoff, the 1,000 people that were engaged with, that would have just been frozen. Nobody would have been doing it. So it was about a proactive approach. When murmurs started to happen that things like this were gonna end, we need to step up and find providers that are willing to step up to do this. And when MVP got the call, we were just privileged for the opportunity to be able to step up, especially here in the city of Chester, to provide this service. Another new program that has started pretty recently, and this is through the county as well, is the Connect Ed program. And so what this is, it's a similar program as the warm handoff, but this is for adolescents. We're working, so we think about the warm handoff, we're working with the hospitals, Letty, we're working with the police, Connect Ed, we're working with the schools. And we're really excited. We got to meet with one of the superintendents at Chester Upland School District last month, and we have a presentation for counselors, social workers, and different staff at Chester Upland School District talking about Connect Ed. And what this program is identified again is being proactive. When there's a red flag, a student or a child, something is going on. There's a red flag, there might be a mental health issue going on, there might be a substance use issue going on, giving us a call so we can meet with them and their families and link them to the necessary resources. And just like the Letty program, we have gone out and we're connecting with all the school districts, and a lot of there's school districts in Delaware County that have an abundance of resources, and there's many that do not. And this program can fill the gap for places that do not. And we're excited to be able to do that. And the response from, frontline workers at the schools is like, this is great, just to be able to have, sometimes to let parents know there's a number you can call to just ask a question. Maybe you just have a question about behavioral health and you're not sure, because as someone that works in the field, it's difficult to navigate sometimes, calling the back of insurance cards and doing this and referrals. So to be able to have some place and people that can help navigate you across those, difficult circumstances. And the Connect Ed program, again, when we first took it over, they talked about schools. Schools are in 9 months of the year. I know that, when I was wilding out, it was normally when June hit, so it's like, what's going on in the summer? So again, Connect Ed, we open this up to the entire community. So it's not that a school has to call us, a parent can call us, anyone in the community can call us. And with that, when we started the Connect Ed program, our job is to link them to treatment, and we saw that state-funded mental health treatment for adolescents and drug and alcohol treatment for adolescents in this county, there was some very long wait lists. We're talking, so we had the opportunity we decided that we don't want to have a program that we can't link people to. So we started our adolescent program here in Chester and in our office in media to be able to have that where an individual's not reaching out for help and then being told you're on a waiting list for 2 months. Like, that defeats the purpose of being proactive with these programs. And one of the things about the Connect Ed and about all these programs and about our philosophy here at MVP is, thinking outside the box and being creative as well. So we had 2 kids that we had got to place last summer, and we worked with, the Chester Boys and Girls Club. and I know, big advocate and appreciate you connecting us, is, they didn't have a mental health or a drug and alcohol issue, but things were going on at school. And as we met with them and met with caregivers, they needed some mentors in their life. And we were able to connect through community resources and connect with that, the Boys and Girls Club to get them that. So thinking it's not always about treatment or counseling, there's other things, especially when we're talking about adolescents and when we're talking about the health, home, purpose, and community, those components of recovery. That's why we work with EDSI that's down here in Chester that comes directly to our centers, working with our clients to help them with resume building and job skills and job placement, working with different expungement clinics and different things, trying to get rid of barriers that people face in early recovery, working with other agencies like ACG here in Chester for STI testing and hepatitis C treatment, and looking at somebody and free dental care, and looking at that full wraparound services where it's not just focused on one thing but a holistic approach. So we're very honored and privileged to be serving here in the city of Chester, and I can't thank our elected officials, our police department, for the support that we've gotten. But we know that there's a lot to do. There's a lot more to do, especially when it comes to education. That's why I'm very grateful for Mr. Long, inviting us to speak at one of his Tuesday night meetings with his families, because so many of these programs that I went down and said that we had, it was like, that's what we need, and we didn't know it existed. So that it's here for residents throughout Delaware County, but it's here for residents in the city of Chester. So, that was kind of like my overview on everything. Wanted to open it up. If, anyone had any questions or any more things that I could, cover, please just let me know. It's a little hot in here.
I had a couple questions.
Yes.
For clarification. I would say thank you so much for coming out, and thank you, Mayor, for recognizing that it's important that the residents of Chester City is informed with the programs that are housed in our communities that are supposed to benefit for us, because a lot of times we don't know, and there's still a lot of people in Chester City that does not know who MVP is. So thank you for coming here tonight.
Absolutely.
Okay. You mentioned some statistics when you first started off about the drug addiction and things and the overdoses in Delaware County. What is the percentage that is of Chester residents in those numbers that you gave us earlier, the 118 in 2012, it went up to 257. How many of those overdoses were Chester?
I got the statistics from the health department, and the furthest that they had broken down what I found was Delaware County. So I didn't get anything like I didn't have anything like different boroughs or the city. So getting it from the state and then getting it countywide, I wasn't able to obtain any more detailed.
Okay, and that's important,
Absolutely.
Because Delaware County is a large, area, and we want to make sure that when you talk about focusing on Chester City, that the data is lining up with your mission and vision. I'll ask you really quickly, and of course, maybe it'll be nice to have some more meetings with you and some of the community partners. So if I can just ask the 3 important questions that I want to ask, and then I'll let you answer them, and we can move forward. Okay. So you also mentioned about the opioid money. I know that was a substantial amount of money. Okay. Can you give us a dollar figure on that, and if that was allocated to Delaware County as a whole or for Chester City in particular?
So my understanding of the opioid money that's coming in, that yearly that's allocated to counties, and then that's distributed by the county.
So the dollar the amount that you guys are getting, right? The question for clarity is, how much of that opioid money is allocated for Chester City? That MVP.
There's nothing that says specifically here or there.
It's just for the overall.
Yes, ma'am.
Okay.
Yes.
All right. And I know that. Do you have any? I know you mentioned the couple of the organizations. But are there any other partners in Chester City that do similar work that you guys are in partnership? And when you were going to make your presence in Chester City, what type of analysis, and I guess data that you gather, and information and input from community residents, how did you determine that there was a need for the services in Chester that you guys provide in Chester City? You know, and was that an overwhelming number that you felt like you had to be housed here in Chester City, or how did you guys come up with the analysis and data to be housed here in Chester City?
Number one was, prior to the closure of that health system, there was 2 opioid outpatient treatment centers in the city of Chester. One served 150 clients, one served 275 clients. The one with 275 moved to Lansdowne at the other end of the county. The one with 150 closed. So knowing that many individuals being served, I don't know at that time how many were from the city, but that many individuals were being served, and then those services stopped here. I also know that when we, opened up and we asked about, outreach here in the city and talking to Mayor Roots and talking to the police, talking about, individuals that are coming in maybe through the transportation center, they're over town, whether they're from the city or not, and engaging with them so they're not increasing the homeless population, whether they're from the city, engaging with them. Do you need help? Where are you from? Where have you come from? We can get you into treatment. So we were told that businesses were reporting that an uptick in homeless and drug use on that side of the town, and that's a lot of the places where the Chester Police took us around to see if we could talk those individuals into getting the help they needed to get them into treatment.
And you're talking about the people who were actually who had migrated into our city, not particular residents. You're talking about when we had
heard that there was an increase of migrate of that.
Absolutely. Okay. And again, there's no percentage when money is allocated in grants. Like, I know it's Delaware County, but if you're here focusing on Chester, is the county saying, well, so much of these dollars have to be
Not that
allocated?
I'm aware of.
Okay.
Not that I'm aware of.
Okay. And no data on why you guys, again, did we have statistics that showed that there was an overwhelm? I know you said about the behavioral health, but the drug addiction was there. Did Chester have those statistics?
Just know that the behavioral health center that was closing, in complete, total mental health and substance use, served almost 1,000 individuals daily. How many a percentage was from Chester? I don't have that information, and they have been here for over 30 years, servicing the community. So I just look at the numbers of, as we see things closing and getting removed, the overdose for African Americans isn't just a Delaware County thing. We're seeing an increase across the state and across the nation. And as we see that, even if I don't have the data of what's going on directly in Chester, to know that major health systems are removing the behavioral health services and the medical services from a community, as we see an increase in that community nationwide. As a individual born and raised here, an honor and a privilege to be able to come down here and fill that gap. So statistically, no, I can't give you the numbers of that, but anecdotally, I can say that something needed to be done because it wasn't right.
Okay, but the data will be available because data is important. That's how you get funding. The data is critical.
That's why I share my numbers, absolutely. So these are my numbers. I don't have what they had.
Okay.
Yes.
And just lastly, I don't want to keep, if anybody else, I know again that, are how many people, do you know the current percentage of residents that are currently now on your recent data that is utilizing the services? And are there any residents in Chester City that is employed with MVP, that the expertise from our own city, are there any residents that are employed?
So currently that we have 49% of the individuals at our center that are clients that live in the city of Chester. And currently at our center in Chester, out of the 26 employees that we have 11 that are residents of the city of Chester.
Okay, native residents?
I don't know their full background, but when I pulled the report, they live in Chester.
Thank you, appreciate it.
Absolutely, thank you for coming. And any kind of information of different organizations or outreach that we can participate in, please, this email on here, please reach out so we can get this information out there.
Absolutely, thank you.
As a person who's personally been impacted by the addiction that born and raised here, is needed, because the treatment that we attempted to get on numerous occasions, it was around, she came in and out. It was not enough to help save her. There was a tragic incident that happened several years ago, and she was left to die. So right now, she's 30-something years old, currently living in a nursing home because the treatment was not effective. So we do need something that's going to be helpful, because there's numerous, I'm born and raised here, that we know that people, they're called the night people. There's 2 different types of people that reside in the city of Chester. If you live here, you know about it, that they do need help. They're struggling. We have homeless men and women that are Chester residents. Some of the people I went to school with that are here struggling. So we do need to do something different. So I hope that all that you have to offer will impact the ones that truly need it and want it, because it's needed. I see them every day.
Sure.
I appreciate
Absolutely.
that. And I think, you know, to Mayor Roots' point in the very beginning is we can have the best programming and resources, but if people don't know about it, it's not gonna do anyone any good. So as reaching out to this community event and individuals that are involved in the community, any way we have Melody, myself, we have numerous people, this is what we do. We outreach, we educate, we communicate. We will go somewhere with 2 people in a room or 200 people in a room. Like, we need to get this information out. Mayor Roots had challenged us to get signs throughout the city. Call this number if you have mental health issues, if you have different things, like getting that information and education out there and breaking that stigma, because there's a stigma in communities as well. You know, and that's one of the things that's so important with our certified recovery specialists and our peer support, that we have a diverse team that individuals can talk to, because there is different stigmas and different cultures, and to make sure that we're working through that, and to know that that's why I feel this, our behavioral health urgent care, when somebody walks in and they have a mental health issue or a substance use issue, there's not people judging, there's not people looking down. This is who we work with, this is who we support. So it's come in, this is what we do, we're not judging. Sometimes you go into a crowded ER and people are overworked and all this is going on and something's taken out on you because it's your 3rd time back for, you know, a substance use issue or an overdose. But coming to us and alleviating those strained resources on our other organizations like our local hospitals. But we really want to take this pledge and, you know, kind of following Mayor Roots' lead here of getting the word out about the services we have right here in the city of Chester that can better serve the residents of the city of Chester.
Can I ask you something?
Yes, ma'am.
I know you're talking about behavioral health, but my mind just raced to behavioral health for the youth. It's a lot of youth behavioral health that's extended from something may happen in their past, and it might be their mother or their father. So is the youth, say if I run into, quote, quote, I have at a Big Brother, Big Sister program, this summer that passed, it was something going on with the mother and the child was talking about suicide. And I can't think of the guy, babe, that run the prison, Dave or somebody. Well,
Prison. King.
yeah, he.
Husband King.
I don't know if.
Sorry.
Sorry. Yeah. My thing to you, if we come across these young people, is everything that's discussed from the youth from a certain age up until at least 17 will not, how can I say, will not be allocated or told to their parents, because it could be something, or it could be a physical, mental, or verbal.
Yeah, so we follow,
peaceful,
so the state guidelines
Yes.
in Pennsylvania, I think is
Okay,
14.
that's what I was wondering.
14,
14,
so, yeah,
okay.
where they can sign their own consents on that,
Okay.
yes, but, and also a thing, even with, you know, if a kid's gonna reach out and needs help, you know, unless a parent is, you know, chasing somebody down, you know, we're gonna do everything we can to protect them and find,
Right.
you know, and not just be calling and you know,
Because some children
sharing
say,
that.
I
I
don't want
know.
my mom to know
And
that I'm telling you this.
And I'll tell you one thing is the back door that we get from 6 out of 10 times when we get a child that calls and or someone calls and we
Yes.
get them into school calls, we end up getting their parents into treatment. Because as we know, it's the cycle.
Yes.
So, and that's
Praise
why it
God.
is so important that we
Yes.
engage the family
Yes.
and we try. So we'll bring them in, family session, alone, together, and it always comes
That's
out
counseling.
because exactly is it's it's that cycle. Often there's the kids that it's just them, but so often, and we want to engage because we can do everything we can for that kid, but if he still goes back to that
Home.
unhealthy,
Yeah.
unstable
Environment,
environment, he's
it's
going to
the
fall
same
back
thing.
into it. Yes.
I know, cause I'm with one.
What about the stigma of
Experience.
these communities, you're crazy if you get help?
Mm-hmm.
How can you break that? Because they say, oh, you getting help, you must be crazy.
Wow.
Absolutely. So that's where our CRSs, and now we have CPSs, which is the mental health certified peer specialists. So they're individuals that they have a mental health diagnosis and they're in recovery from that. They're still, mental health's different with substance use. They're still on medication, getting their counseling, but they can share, and especially like I said, is we really try to have that diverse group. So an individual comes in and it's not like one of those, oh, you don't understand, you haven't been where I've been. No, that's why with the CRS is somebody, we have our individual who works with the probation kids. He's been to jail, he can share that, different people that can understand what someone's been through. So we have our CPS to share about that, especially culturally, to share. I understand where you're coming from. My grandmom was old school, and it was like, you don't do that, you don't tell people or get medication, and that is how we try to break down that stigma of that.
That's good.
Yeah.
Very
I was gonna
good.
say, I really believe that a community partnership is very, very important, because like you said, we know the residents of our community, and I think it's important that we can, and myself, I actually did come over to MVP and I passed out information to people who are drug addicted, and I am hopeful that some came over. They said they were gonna come and to get the services. So it's important, that we do have community involvement and partnerships to make sure that Chester residents are being serviced. And with that being said, does your organization that is housed here in Chester City, do you guys have a targeted percentage of clients that you want to service? Is there a number, like, that you have set a goal or mission, for Chester City residents? You said you want to outreach, you want to serve, like,
Our goal is for every single person that walks through our door that wants help, gets the help they need. It's an unprecedented time through the funding and through the leaders that we have, that the barriers have been removed. 31% of the 160 individuals that have come through the 24/7 behavioral health urgent care, 31% of them were homeless population here in Chester that just came up and rang our doorbell at 2-3 a.m. in the morning. So we have no limit. Our goal is to help everyone that needs it, and we have the resources, capacity, and it's just an unprecedented time to have the funding to do that as well. So to get that word out there, especially people that have been through the gambit and had been told no before, that just come, like, that's the thing is, oh, I got this, I got that. We tell the POs, or we tell the teachers, or we tell the hospital, whatever. Just tell them, okay, tell them to come to MVP. We will figure it out. There has not been one person that comes with some situation that we can't call the county governing body and say, can we get an exception? So-and-so needs help.
Yeah.
Thank you, Doris.
Yeah, I own a house, it's the 300 block of 19th, and I see you right there on 19th and Walnut, I think, all the guys. When Jason Kilpatrick first bought it, it seemed like it was like a surplus of people, but now I don't see as many. I guess my question is there a maximum on the number of people who are in a building or in a house?
Absolutely. So there's regulations that per square footage of everything that individuals, as far as how many people could stay in a bedroom or anything like that, yes, that's all state mandated and inspected by the state and the county up to 2 times a year, yes.
So you just opened a female house on 19th Street, I understand, recently, is that true? Or is
Not on
it just
19th.
the male at 19th? And I don't see as many guys as there used to be. Did you like decrease the population?
No,
Maybe because it's winter.
it'd be cold out.
Yeah, right. You need more houses?
There's always needs. But as far as looking at that, no, it has stayed pretty constant.
Okay.
That has been an issue. Like we, a lot of us residents have brought that up. Although we are very appreciative of the services that needs to be provided, it's still also for some of us a safety concern. We have our families here, we live here, our children are here, and I think it's important, that communication happens. And
Absolutely.
we have been really not privileged to have the communication, and that's why sometimes we're kind of skeptical, when organizations come in and they're housed in our city. That's why data is important to us. We want to know percentages. Mm-hmm. If an organization says that we're here to serve Chester City, we want to make sure that they are intentional about that. You know what I'm saying? I know we're open to everybody, but it's important. It makes a difference because, I would take the position, well, maybe we should house it, maybe where most of the clientels come from, but so we look at things like that because
Absolutely.
Chester City, as we're talking about, under the mayor's leadership, growing and developing our city, we have to look at the type of things that are coming into our community, and it's very, very important.
Absolutely.
We want to feel safe, and so we need communication about this. What are some of the people we're dealing with, because it sounds good, but at the cost of our safety, we may be reluctant to that. And these are things that we want the community to be addressed with, ongoing, and so that we can be confident in the services that are happening here, but also to ensure that we're going to be safe while we're, helping people to be better. You know what I'm saying?
Fully understood, and
Absolutely.
I think that's why it's so important of any agencies, that operate, in the city, really, understand the city, put their money where their mouth is. One of our MVP houses is, next door to my parents, where, my kids are, my youngest is babysat 4 days a week. Best neighbors they ever had, because they had Widener students there for 12 years beforehand, throwing beer bottles and, urinating on the bushes and whatnot. So very grateful, but showing like that ability of, having those regulations and knowing who's licensed and contracted with the county, what a difference that makes, having legitimate license, because then there's things to follow about size and square footage compared to not having that. Absolutely.
Yeah. Did you say how many houses you guys have in Chester? How many houses are
in Chester altogether? 19 in Chester, 6 in Media, 2 in Phoenixville.
But that will be a homeowner's concern.
Mm-hmm.
You don't want to have a whole city full of recovery houses, which will possibly diminish the value of the properties. So that's my aunt, one of her biggest concerns, is that because we know people need help, but there's also a lot of homeowners. So how are you considering expanding, or you're trying to stay at a certain level of houses that you're purchasing? You know what I mean? That's a big concern.
No, I think that, where we are, we've been pretty consistent where we've been for, we've been operating for the last 10 years. It's been pretty consistent,
Okay.
Where our size is. It's the other counties that are kind of coming to us, asking us, if we'd be interested, the model that we have, something's working, so
Okay.
that's where we had expanded to Chester County. And, it's, I'm really focusing on the behavioral health services as far as the treatment and the different things like that we had the opportunity to expand when the system closed here in the county. So, yes.
Now, I don't keep harping, but I just want to let you know that data is going to be important again. You have to have data and analysis to prove and show, because these are getting government dollars. Why we are housed in Chester. 19 houses is a lot of houses, okay? And if this is not the greater part of our population that needs these services for the protection of residents, we shouldn't be housing these many houses here, you know what I'm saying? And so we got to really look at that again. That's something that we take serious as residents. We want to be involved and make sure that we have an input. This is important to us. Our safety is very important, like everybody else. And we just want to make sure that we are being treated respectfully when it comes to that. Again, we're not too impressed with things that are really truly maybe not benefiting us, but more, like you said, a stigma to hinder us more as we're trying to grow. I'm all for this, but we're not trying to be, and excuse my expression, the dumping ground for what other people in other areas don't want, okay? And that's something that is a concern to not only myself, but other residents who has brought this to our council in the past. But again, I am glad that you were here, but again, data is important. We're, to say, just to talk randomly, that's good, but data is a determination of why we exist where we are, and that's important to us Chester residents, okay? And that's something we'll be looking for as residents in the future.
Absolutely.
Okay, but thank you, yeah.
Absolutely.
Data girl,
Gotta
data.
have the data. We feel
I
if you
know.
don't need the
Then
data.
seniority just
Gotta have the data, but it's good.
Just geographically close to them, yes. Yeah.
You answered that.
We gonna send them
And
over.
do-
We appreciate it. I hope more come because it's needed.
Anything we can
And
do,
you got
please
people
let us know.
at the train station from Frankfurt. They need help
Yeah,
too.
yeah.
Yes.
Yeah. That's it. They come from where I sit.
Thank you. I think I'm gonna have that.
Any other questions for Brian?
No, thank you.
Okay, let's give him a hand.
Can we have questions for you? No.
I want to make a couple statements based on the questions that were asked. And
Yes.
Anita, so thank you so much for coming. You always hit the points. So
Yes,
one
you
of your
did.
first point was data, and you're hitting that one pretty strongly. And I think Brian answered it perfectly, but it wasn't the answer we wanted to hear, particularly when it comes down to drilling down to Chester in particular. It's only been a couple years that the Delaware County has created a health department, and now they're collecting statistics that are readily available to anybody in Delaware County. But we want Chester stats, and they just don't do it unless they're asked by the right people. And I can say that we have the right person in place here in City Hall right now in the presence of Dr. Kristen Motley. She has the ear of the Delaware County Health Department. They listen and do when she speaks. So I'll give you a perfect example. The statistics that you were asking of Brian, where he said he just has it down to the county level. That's the same thing they said about lead, and that's one of her first missions, Dr. Motley. And she went in there and insisted, you gotta break this down. You gotta break down these county numbers for Chester in particular. Within a couple weeks, out came the report for Chester numbers. So I'm gonna take your ask to her with regard, to the numbers that he has. He can only give you what he has. Let's do a funny for a moment. Hand me that one on top there, the Star Center.
Talk about his, I thought it was somebody's TikTok.
So I said, Ryan, Jason, we got to get the word out. We got to let people know that you're there and that you've got services, and we got to get the number out. We got to get the address out. And like you said, pretty quickly, they drew up some long signs. It says, how about if we put these all the way down 291 and on some of the busy corridors? And I was like, yeah, that would work, but I never told you why I said don't print the signs. And this is why. It's your logo itself. So when you blow this up, this MVP recovery, and you got that little house there, it really, in passing, and you only get a glance, it looked like a real estate sign.
That's what I was going to say. I was going to say the same thing.
So
It
I
does.
still think it's a great idea,
We
but
can get some
somehow
numbers
when we do,
It's a what? You think it's a
when
what?
we do something for mass
Anita,
consumption,
would you say
we're
get
gonna
some
have
what
to
out?
change. We're gonna have to change something up.
Duly noted.
I didn't want people to be like, oh, MVP, yes, I want to buy a house, or they want to buy my house, that type of thing. So that was that. I got a question. We talked a lot about behavioral health, but we're also talking about drug and alcohol treatment. I've learned a lot about your side of the business in the last year and a half in particular. And I was surprised to learn, and I need you to talk to this, like you can't do drug and alcohol treatment without addressing the mental health. Is that correct? Is that what I'm hearing from professionals
So-
out of your space?
Yeah, I mean, what we look at now is, coming in, first of all, we identify what's the most acute crisis at the moment. So if someone's actively using, it's normally the drug use at that moment. So once we get that stabilized, and that's why we have gotten the mental health license at our behavioral health centers, because we're trying to get rid of that imaginary wall in between, because someone gets stabilized, I'm sober for 6 months, 12 months, but I have co-occurring condition, I have depression, I have trauma, I have anxiety, and I just think getting sober is gonna solve those things. Oftentimes, I started drinking or using to help me cope with those mental health issues. So important for an individual to then transition with that mental health, to start it with the drug and alcohol, but to continue it long term. And that's what we're seeing with the mental health is individuals, they come in for us for drug and alcohol, they get stabilized, they're with us for up to a year, then they may go into our center to see our psychiatrist for the next 2, 3, 4 years, you know, because they need medication and they need to continue that on. So it's really looking instead of, and that's why we're trying to say behavioral health, instead of saying drug and alcohol, mental health, just it encompasses all one thing. Yes, sir.
Gotcha. That's a good
That's a
answer.
good question. Yeah.
The other piece that seems to be the theme with all of your programs is that someone's identified needing help and you have someone walk them in, whether it's a teacher with the Connected or someone related to the school district, or Officer Ross is gone, you know, a police officer, and that seems pretty logical because individuals, particularly here in Chester, are so skeptical. Aren't we, Anita?
What's that?
It's just
Aren't we skeptical? You know, you gotta
People
show
in
us.
Chester.
We're from Missouri.
We're just realistic and we want the change that we deserve. That's
Yeah,
what it is.
so
We don't
we
want
would
to keep getting
love-
abused, that's all.
I mean, we
But
would
we are
love for
skeptical,
people
yes.
who could self-identify as, I need
We're
help.
skeptical.
That's the place to go. For
Yes.
instance, if I fell down and hurt my knee, twisted my ankle, hit my head,
Yeah.
I know in the best times I could go to Crozier and go to the ER. I mean, it's you don't even think about it. We just have to get to that point where people realize that, you know, drug, alcohol, or as you said, behavioral health, that's the place to go. It's like, we have to get to that point. It's great to have these
Absolutely.
programs where you can hold people by the hand and bring them, because some people just need a little bit of push, a little bit of help.
Right.
And once they get there, they're cool. But you know, like, we have to continue to think about getting people to the mindset that there's places that you can get help for, you know, almost anything. So
Yeah.
that's what we want to do. Lastly, you said this really quickly and you let it fly by, and I have my wife here tonight, and she's one who, if you're going to serve her in any form or fashion, you better prove that you've gone through yourself. You know, you better be a professional, but not just by books, but by having experience.
Yes.
And you said that at some point in your life, you were wilding out.
Yeah.
So tell us a little bit about your background and if it shaped, formed, and encouraged you to get into this type of work.
No, I mean, that's where my passion comes
Yeah.
from, is, you know, I had
That's what I felt.
brought up, you know, had, you know, substance use, mental health runs in the family, that hereditary's there. Had a great family, tried their best, had their own things they had to work with. Got the privilege of, you know, being sent to a great Catholic school here in the city, was given all the opportunities, and you know, the dark side was more attractive to me at the time to, you know, mess around with certain things and think that I'm okay. That Superman mindset of, you know, I know so-and-so got hurt from this or died from this, but I'm gonna be okay. I'm gonna be different, I'm unique. You know, and that led me to, you know, just a life of despair that ended by the grace of God at the age of 23 when I got clean and sober, and went to, you know,
Yes,
thank you.
that's a blessing.
Thank you.
That's a blessing.
And
Yes,
that
it
was
is.
just, you know,
Look at God.
and, you know, looking back on that, going to the Keystone Center 3 different times with my bags packed, but insurance not linking up with me being able to get in, you know, and like thinking of that. And that's what so proud of, like, and that's why I always harp on the fact of those barriers, because I remember that, like,
Yes.
I couldn't live no more. I didn't want to live no more, and I wanted help, and somebody's telling me, come back tomorrow, you know, and, yeah, that's where the passion is, and that's where
Yes.
people like Melody and
Definitely.
our peer supports, they have that background, and there's nothing greater than to work with someone that is in that, that moment. I mean, Mel, someone that graduated from our program, and now she's employed as a coordinator, you know, and to be able to have people come back and be a part of this and see them help other people is just, it's absolutely amazing. So I appreciate you asking that, Mayor.
Yeah. Thank you.
And I felt
Yeah.
that.
Yeah.
I felt your spirit. I felt that, and it's to me, it's very important to whatever you do in life. You know, if you've been through something and you want people to be able to empathize and have compassion and understanding of what you've been through, and the same person, if when people come to you and you tell them, you let them know they more comfortable. They're more accepted to talk and let everything out.
I wish my.
I
niece
love
was
that. I love that about
Yeah.
You
Dr.
guys
Philbin.
did.
Oh.
I mean, you go visit her, she's not the same person, she's only 30-something years old.
Yeah.
And she kept taking her over to the treatment, she kept coming back out. 24 hours is not enough
Yes.
to hold someone that needs help. And it happened here in this city, and she's here, but she's not here.
My
She
God.
never got a, she's not mentally, emotionally, and physically.
My God.
She is on, and she has 2 children, but she had a family of love, that her kids are taken care of. Everybody don't have it.
That's right.
So that's why I came. I wanted to know, I'm like, MVP recovery, what is it? What kind of place is this? That's what it was like. It's like, wait a minute, I thought you was going after houses.
Not real estate.
And I had to
And Mayor Roots, thank you really for answering that. And when you asked the question about skeptical, I was just making a joke, but really what the people of Chester want is we want people to just be honest with us and to really care about the real issues that we're dealing with. And so often we have felt like people really just didn't care. We were just another, number, a place to come in and take advantage of and to benefit from. And so to have an organization that is really gonna take, the mindset and the mission to care about what's really going on in our city, that's all we really want.
No, I get it,
And
absolutely.
so we appreciate you again, Mr. Mayor, for understanding that we need these type of interactions. I wish more people from Chester City was here, but hopefully this will not be the last time, so that people can be, confident to say this is somewhere that we can actually go and it's gonna be here, it's gonna last. It's really for us.
Yes.
And this is why we're saying we're keeping our eyes on it, because we want things to really, truly, transparently be for, the residents that it was targeted or
And that's-
intended to serve.
And that's where we need everybody's help to get it
Yeah.
out there.
A better chance.
Absolutely.
All right, listen, you're just touching the surface because people don't trust.
Yes.
Yeah.
Because we remember, those of us who grew up here and you grew up in
Yeah.
Portland, out in that area, the 70s and 80s,
Yes.
where this city is still recovering from that period.
Yes.
There are still people in jail
Yeah,
who have been away from their families,
Indeed.
haven't seen their kids
Yeah.
grow up, have had their mothers and grandparents, die
Yeah.
in prison for stuff that they wouldn't be sent away for that long for. They needed help back then too. And the answer was, you're going to jail, you're a super predator, that whole, mindset. That's why we don't trust trustworthy people like you. And that's why we have to work even harder, because we have so many people who are still recovering from that period. You mentioned it. This is the golden age of recovery. God bless the people who recognize that what they did to particularly communities like these just destroyed them in the 80s, being very punitive for the most minor
I got
things.
stories.
For the most minor things. And you've been on the streets and you know.
I lived it.
So you are
I think the 80s was.
I didn't live
I'm an
here,
80s
but I
baby.
lived it.
I'm an 80s baby. 80s was a good area for me here in the city of Chester. Though we had a lot of stuff going on here in the 80s.
It was a good, it was a good area, but it wasn't, because a lot of families got destroyed. You had to go into the smokehouses, you had to go into the live wire, you had to go, money was being made, when families were being lost, broken, and abandoned, and those kids have not recovered, those adults have not recovered, and a lot has happened. There was so much drugs on the streets of Chester, and you had kids, their families, the food stamps were being sold, lights was being off, kids didn't get fed because parents had problems. And those kids are the ones walking around today. So it might have been a golden age for some, but it was a devastating age for others. And I saw those babies, I saw those people, lights not being on, and I was a child here in the city. I'm thankful that my mom, but I saw what it did. I saw the smoke houses. You had so many smoke houses in this city.
Yeah, I was one of them kids. Well, didn't have electric and all that. Had to run the electric cord from over there. But I gotta say that, I mean, like I said, as far as a program, it was in place. I mean,
Because
it
it's for
reached.
him.
A lot of parents, they were so busy trying to recover themselves. A lot of kids didn't get those services.
Yep.
So we just gonna be honest. I was here, and when my son's father, I can tell you, going to the live wire and watching them sit around in that room and watching all them people get high. My son didn't benefit from his personal decisions, and there was a lot of kids that parents had to live that. So it's like,
we can't go where we was, but I'm thanking God that we got a new day. So
Yes,
anybody that's gonna hear this new day,
Mhm.
I'm gonna tell it because I saw what it did.
Right.
Yeah. And we didn't have the services, what
No.
we're saying. In some communities, we were treated as criminals. In
Yes,
other
it
communities,
was. And that's the truth.
it was a health issue. And
True.
so we gotta recover.
balance
We
is
gotta.
here.
So this,
Yeah.
this,
Yeah.
I,
Yeah.
all
Yeah.
that's right, all that's true. Thanks
Yeah.
for doubling
And it
down on
Thank
it.
you, guys.
But the key right now is
Move forward, right?
we are in a good space
Yes,
right
we
now.
are.
Forward,
So for the
absolutely.
people who are
Take
just
it.
experiencing,
That's right.
the drug and alcohol abuse and having their mental issues, and it seems like you just multiply that by a lot right now.
Yeah.
We've got money to
Yes.
support services that are run by great people.
Yes.
That's what
But there's also that element of historic recovery that can also benefit by
Yes.
this new golden age of having a lot of money being put into organizations like yours that are run by good people.
Yeah.
We are blessed to have organizations like this in our city.
Mm-hmm.
Just in that room, there were 2 hearings to deal with the sober living facility here in this city just last month. If you want to get the best recap of all places, the Spirit newspaper had the best write-up as to how tricky it is when we talk about 19 houses, throughout the city for people to continue their recovery after they, get your services. Some neighbors just came in and had to sit with the zoning department, and they kept calling me, they kept calling Justin. They were like, why? We were like, look, we got a process for this, and it might have been the first time I've ever seen a hearing type setup with the zoning board, and it looked like trial. The second one was how many hours? 5, 6 hours? I mean, they sat in there till they resolved it. And reading the newspaper account in the Spirit, they basically said there's a lot of gray areas here. This stuff hasn't been figured out. They didn't go so much as to say it was right or wrong, but it's here. And I was so proud that we went through a process to sort this stuff out. We've got good people operating with the law in the best way. We have other people operating with the law in the worst way. And sometimes the good gets overshadowed by the bad. What I wanted to do is bring MVP in because I know they're doing it right. I know the people who run the organization. I've known them for years. They're doing it right. So if you have to have a service, bring somebody to get treatment, go here.
Okay.
It's on. Here's a terrible analogy. Don't buy your weed off the corner, go to the dispensary. Okay? Because it's been curated, it's right, it's safe. That was a terrible example, but it's relatable. All right, before I go too much off script,
Yes.
I want to say one more thing. One more thing that Brian has supported out here. I called Brian and I said, "Hey Brian, look, this guy has this piece of art. It's a movie, and in the movie, family substance abuse is a real topic. I really would love for you to hook up with this movie maker and maybe consider sponsoring his creation and build out of this movie." I don't know how it worked out. So how did it work out?
Turned out well.
Okay.
Yes, and he was very, very grateful and appreciative. And once any opportunities kind of open up the conversation with community and our staff and what he's doing. So yeah, Butch was very appreciative of it.
I can see you guys marching that project together. As mayor, the 2 real superpowers that I feel I have is connecting and convening. So this is an example of both tonight. I'm really proud to have brought you guys here to the lecture series. I think it's going to be a great video. It will be on our city website. There will be a link to it. It's broadcasted live. Thanks to Miss Anita. Thank you for that. You guys have a good night. Do we have one scheduled for next month?
Yeah, so in March, we're going to have the Lead Task Force will be presenting on Lead-Free Chester. So they just did an event at the school district. They'll do one in March. And then in April, Nolan Fontaine will be presenting on...
Dr. Nolan Fontaine.
Sorry, Dr. Nolan Fontaine will be presenting on, I think, the Indian heritage of Dr. Martin Luther King.
Okay.
And then in May, you have Christopher Rogers coming on Chester Ain't a Third-Class City.
Right.
So.
One that I'm also looking for that's almost related to this is, I don't know if you heard the governor's budget address today, but he kind of snuck in there that cannabis will probably be legalized, or he's looking for it to be legalized. this year. I just happened to meet one of the attorneys that has worked in New Jersey to work with their legalization. When I talked to him, it must have been about 6 months ago, he was like, Pennsylvania's gonna do it right, because they see some of the places like New York and New Jersey in particular, who have a few things that, you know, could be improved with time. So I've invited him to speak, because I think that'll be really interesting, especially the fact that we have a couple dispensaries around here, a couple grow operations. I don't know what goes on in those buildings, and I probably have every right to smell. I probably have every right to go in there and find
You
out.
can smell it going down 291,
But-
and people that live in that community.
He wanted to wait till it got closer to
Yeah, I can understand.
to being a real thing in Pennsylvania, but I'm really looking. And again, as I said earlier in the introduction, if you guys have any topics that you guys would like to hear discussed, any subject matter experts, bring them to our attention. We try to, we do this once a month, but there's no limit to how many we can do. So you're gonna get at least once a month, but if we have people who wanna come up here and share with us, there is no limit other than maybe once a week. So maybe 4 a month, I think, is gonna be our limit, but
Thank you.
thank you guys for coming.
Thank
Thank
you.
you guys.
Yes, sir.
Thank you so much. Thank you for viewing.